Hi, my name is Caroline Garcia. I'm going to be performing 4 injections for my skills video for pharmacology lab. Before I start anything, I have practiced using proper hand hygiene. I'm so sorry, proper hand hygiene. Put on my gloves, everything like that, and I'm going to have these on for the duration of the video. But before every injection, I would wash my hands again, put new gloves on, and ensure, because every patient's going to be different, so ensure patient's privacy, ensure that I have the right patient, ensure that I have the right route, using the right needle, inserting the right medication, everything that I need to do. So the first injection that I'm going to be starting today is the intramuscular. So I am using a 22 gauge 1-inch needle. I have sterile water and my prep pad. So as I'm prepping for the patient for their injection, I am also going to, I'm going to clarify that this is going to be the deltoid right here. Goodness, I'm so sorry. But okay. And I'm also going to clean the top of my bottle here. Okay, I'm going to take off the cap. Those always give me a pain. Okay, I'm going to take back some air. And I would be using all new materials for everything in this video, so my apologies. Okay, and I'm going to pull back just about, that's way too much, 1 milliliter. That's my fault because you're not supposed to push air back into the medication. So don't do that in the real world. I hope you all had fun watching that. But I have 1 milliliter up here. And what I'm going to do is I'm going to take the skin like this, and I'm going to use the 3-finger method in the pinky. And I'm going to go to the top of the patient's shoulder, just right here. And I'm going to go 3 fingers right here. And then that spot right there is where I'm going to be injecting whatever medication that they need. Okay, so I'm going to take it like this. And then I'm going to, at a 90-degree angle, insert it, wait a little bit. Oh yeah, I forgot to push down for these ones. I wouldn't in a patient, but for these, for these ones I really have to push down. Okay. Oh, I'm just kidding, it's already in. I didn't see the fact that I had already injected a lot of it. Then I'm going to practice proper needle distribution, and I would throw this away in a sharps container. Do not reuse these, but for this video, I'm going to be reusing a lot of needles. So dispose of that, and then and of course, Band-Aid, take care of the patient, of course, always. But that's it for that injection. Stop. Okay, so for my next injection, I'm going to be doing sub-Q, and I'm going to clean the area, disinfect the area. I know you also don't repeat the steps, but I'm so sorry. Clean everything off. That's number 1. I have filled up my syringe already. It is a 22 gauge 1/2-inch needle. And I've already filled up with 5 ml for our injection today. Oh, excuse me. And usually I'd go and take out the medication from here, and then inject it into the patient, but I'm just going to speed things today. Right now we're going to be doing in the abdomen, so I'm going to remove the cap. It's going to give me problems. Remove the cap, pinch the patient, and at a 45-degree angle, I'm going to insert. Okay, and leave it like that, and then take that in, and then pull out. Okay, and then for these ones, I would also dispose away in the sharps. You do not reuse these, but for these videos, I'm going to be reusing them. So for this next injection, I'm going to be doing intradermal. So I have already prepped the skin. Oh no, just kidding. I'm just gonna do it for the video, sorry. Prep the skin, prep the bottle, practiced everything like hand hygiene, new gloves, everything that I said at the beginning of the video. Also, something that I forgot to mention is using proper documentation before and after the injection. But today I'm going to be using a 29 gauge half-inch needle, and I have about 5 milliliters drawn up. Oh, sorry, just kidding. 5 units drawn up. I don't know why I keep saying milliliters. I'm sorry, I'm just used to that. I'm gonna take the needle. Skin is prepped. This is going to be on the patient's forearm. You'll see these normally with like TB. You're gonna take your index finger and your thumb. You're gonna go like this on the patient's skin, and you're just gonna pull apart. And with this one, you're basically gonna be flat on the skin. So you're gonna be about 5 degrees to 15 degrees for the angle. Oh, I didn't mean to poke it. Sorry, that wouldn't happen. But what I'm going to be doing is I'm going to insert it like this, just about 3 millimeters into the skin, and then slowly, oh, please don't pop on me. It popped, sorry. Anywho, so we have our wheel, and then that's not supposed to happen, and it won't happen with skin. It's just there's a lot of holes in these, and then I would take that, dispose of it, and draw a circle around the wheel here. Oh, that's bothering me so much. Go away. Anywho, draw the circle. Take care of your patient. But yes, that's all for intradermal. Hello, now it's time for the IV push. What I'm going to be doing is I'm going to drop my medication first. Usually, the medication would already be like, you know, set to the side and ready for me. But I'm going to draw up about, it's being stubborn, 1.5 mLs. Set that to the side. Okay, and then I'm going to, I messed it up, but I'm going to do the scooping method. Put that back on, set it off to the side. Okay. Oh goodness, something that I forgot to do, and I'm so sorry. But always, always, always clean the vial off before you start. Always, always, always. I know to do that. I'm so sorry. But clean the vial off, and then I'm going to go over here to my patient. I'm going to take this cap off the hub. Clean, clean, clean. You would also reuse different alcohol pads, but I've reused like thousands, and so I don't want to be wasteful. So, and then you'll take your flush, come over here. I'm not going to flush because I heard we are not supposed to. So just, you know, I'm gonna put about 2 mLs in there, flush that, take this off, recap this, set this off to the side, and then I'll take my medication. Clean this again, sorry. Okay, then I'm taking my medication, removing the needle, if it'll come off. Oh no. Promise I'm being safe. These needles just never wanna come off for me. Oh my word. Okay, here we go. Got the needle out. So many bloopers. Okay, and then I'll take the medication. Insert, so since I did 1.5 milliliters, I would do it for every second. Don't wipe your nose when you're doing this, that's really unsanitary, sorry. But then I'd insert for however many seconds I put in. For however many seconds I'm, goodness, however many milliliters, this is a yes it is, however many milliliters I'm inserting into the hub. Oh, and another thing I forgot to mention, I stopped the IV before the video. I've been practicing a ton, and I forgot to unstop it and stop it again. So you would do that before you start this as well. So sorry, I'm kind of at a rush for time. Then I'd dispose of this, put that away, clean the hub once more, and then take this, insert, flush again, and then I would put a new one on. Put a new cap on, twist it tight, and there you go. Oh, one thing I did forget to mention. On these, you want to check and make sure for redness, swelling, irritation, anything like that, because, you know, that's not too fun for the patient. So, but other than that, those are my injections for this video, and I hope I did okay.